Awesome. So to get started, I would like for to begin with a little bit about yourself, Jeannine, and a little bit about Clearway Pain Solutions and just your mission, the vision of the company.
Sure. So I am VP of Patient Experience for Clearway Pain. So my role is really focused on patient access and intake and just overall contact center operations. For me, it's about really ensuring that our patient experience is seamless, from beginning to end, and of course, patient-centered. So, and then just a little bit about Clearway. So we are a multi-state healthcare organization that specializes in pain management. We have a couple different brands under the Clearway umbrella. So we also have Relievus, Eastern Neuro, and Center for Pain. So we have clinics up and down the East Coast. We have many clinics here in the DMV area, which is where I am. We also have clinics throughout Pennsylvania, New Jersey, Georgia, South Carolina, Alabama, Florida, and Texas. Hopefully I didn't leave a state out. But yeah, so I think what sets Clearway apart, from our competitors would not just be, our ability to treat pain, because we do that very well, but also I think it's our commitment to improving the overall quality of life for our patients. And so we do that through accessible and coordinated care. But no, I'm excited to be here today to just talk a little bit about how our partnership with LeadSquared has really transformed our referral management process completely.
Awesome. Thank you so much. I want to dive a little bit into some of the key challenges slash pain points that you guys faced before having an integrated solution with Athena as your EMR and LeadSquared as your CRM or referral management system. Whether it was, and it could be broadly categorized maybe under operational, patient engagement related issues, anything on the how the call center was sort of working and how that changed. So if you want to touch on just mainly the key challenges and sort of pain points.
So before implementing what LeadSquared, our referral management process was very manual, extremely fragmented. We would have referrals coming in from all different channels, and our team would work out of a shared inbox in Outlook and then track it manually in a spreadsheet. So anyone that's ever had to work a process like that knows just how challenging that can be. It really slows down your operations. Ultimately, of course, that leads to, delays in scheduling, which then leads to delays in patient care, which goes against everything, my team is trying to achieve. So we knew that we could do better and that we had to do better. So we started looking at a CRM solution. We wanted to get out of the manual, get out of the spreadsheets, and really find a system that could help us be more efficient. So in all honesty, I at first looked at Salesforce. So that was one of the solutions I initially considered. I had worked with Salesforce in previous organizations. I was very familiar with their platform, but really the price tag was prohibitive. And I felt that it wasn't purpose-built for healthcare referral management in the way that we need it. So at that same time, our marketing team, they were looking for a platform to, kind of help drive their initiatives forward. So it was kind of like, why don't we team up together, and see if we can find a platform that can help both departments. So they actually introduced me to LeadSquared's. And so that's how I first became introduced to you guys. And, the thing that initially really drew me, of course, was the integration with Athena. Because LeadSquared can actually implement with Athena. I think a lot of other platforms say that they can, and they can to a point. So they can get your scheduling template, they can book the appointment. But if you've ever, worked in patient scheduling, it's more than that, right? It's deeper than that. And Athena, you have to run the insurance, and that's what LeadSquared was able to do that many platforms can't. Like, I didn't want my team to still have to kind of do what I call like the swivel chair, where they would be like working, like in Athena, booking the appointment, and then having to go into the CRM and kind of going back and forth. Like, that's not efficient. So it LeadSquared, because you guys can actually run the insurance and do everything we need to do. My team gets to work out of one system. So everything that they do in LeadSquared is automatically into Athena. So it really, again, cuts down on the time from our perspective. So that was, of course, my selling point, to your team. And I'll add too, besides the technology, I felt that your team was such good partners. Like, they really sat down with us and helped us like mold out our workflow. And I'm like, this is what I need to see in my CRM. I want this logic and this automation build, and I want my template to look like this. And your team was able to do that with me. So it was definitely more of a partnership, as opposed to just selling me a product. I
Awesome.
definitely
That is great. That is great. Thank you so much. Um, I think typically, we see with most EMR integrations, they need basic sort of interfaces where as far as the demographic information is being, going from one system to the other, or maybe appointment information, right? I think we've done one of the more complex, sort of more detailed integrations for Clearway. Um, at a high level, if you want to just touch on the different kinds of data points that you guys were able to integrate LeadSquared and Athena um, as two separate systems, right? What was the different kind of data points that you guys were able to accomplish as part of an integration? What were those workflows look like? And how did that impact you having the ability to see data consolidate in one sort of view?
Yeah, again, like I was saying before, other platforms can, book the appointment and secure the appointment, but that's all that they do. So they don't run the insurance, they don't take over some of that, demographic information. And then that means that now I have to have someone manually go from one system to the next. And that wasn't what I wanted. If I was going to invest in a solution, like, it needed to be a complete solution. And that's what LeadSquared was able to deliver to us. So again, everything that my team does in LeadSquared with booking that appointment is automatically in Athena. We don't have to go back and forth. So we run the insurance. We know if it's eligible or not. Like, you guys were able to build those API connections that are going to allow us to work out of one system so that we can be the most efficient. So, and we're still somewhat new. We've only been with you about a couple months, but we have, plans with our LeadSquared team to take it even further. Like, I cannot wait to be able, when I'm looking at my data, not just to see, okay, how many referrals did I convert to an appointment, but out of those appointments, which ones actually were successful? It's one thing to book the appointment, but it's quite another to get the patient to the appointment, which of course is our ultimate goal. And I can't wait to be able to see that right there on my dashboard with LeadSquared. So I can report out, again, not just the conversion rate, but how many of those were successful appointments, without, again, having to run multiple reports like we do now. I'll be able to see that seamlessly right on my dashboard because of the integration you guys have been able to build.
Awesome. Awesome. Coming to your experience working with the team before, like in the evaluation phase, and then the onboarding, and then the implementation, and then obviously you guys have started using the platform. Now we are in the phase of sort of exploring more use cases and how that journey's been. Uh, how was your experience? How was the team's experience? And beyond, just the core team that works day in and day out with LeadSquared on, building this out and figuring it out and testing it. Obviously, how was the response of the users that actually use the system, right? I'm bringing a new technology. I know is a big learning curve for anybody.
Yeah.
But how was that reception? What was their feedback to you internally? How did they like it?
Yeah. I mean, ultimately, right, we have such a good partnership. So our onboarding with LeadSquared went relatively smooth. I mean, we launched our Mid-Atlantic and Southeast regions like end of January. And then our Relievus market, we just launched last month. Our team obviously loves it. It's very user-friendly. There's not a lot of questions on how to, navigate through the system. But anytime something comes up, so if we do have an issue, we're able to reach out and your team is very responsive. They'll troubleshoot. Again, if anything does come up, there's never like a major disruption because the responsiveness from LeadSquared has been, just that good and that successful with us. With our dashboard, because remember, I just recently got that a couple weeks ago. It had to take a little longer, but I went back and forth a couple times with the team, with the LeadSquared team. Really trying to get them to see my vision. Like, this is what I need to see to run my department. And then my team, like, here's what my director needs to see. And here's what my call center supervisor needs to see. And so we were able to build different views, again, customized to what we want with the data and what story, we're looking to tell. And so again, I just appreciate all that back and forth with your team. It's kind of been like, if we can dream it, your team can build it. Like, I gotta tell
That
them this is
actually
what I
should be the
want.
quote of this case study. That's the line. Avantika, you've got your one line. And the
Yeah.
line
But
of
I'm
the
being
case study.
serious though. I go back and forth with them so much through this process. Like, wait, no, I need it this way, or I want to see it this way, or let's try it again this way. And the LeadSquared team is so responsive. Like, they'll come back like, okay, let's go back and try it again. And so that again is what I've appreciated. The technology tools that you guys have built are great and will set you apart from your competitors. But to me, the most important thing is the partnership. It's the team that I'm able to have there. Again, nothing has been perfect. I'm not going to be like, oh, everything was 100%. No, it's not real life. There's always going to be things that come up and little tweaks here and there that we have to make. But it's how the LeadSquared team has responded with us. And again, the ability of what they've been able to do within Athena and those API connections that have been really impressive.
Awesome. Coming to a little bit on just measurable outcomes, some metrics, right? If you had to put in, let's say, your top three most positive outcomes that you've seen um, with the integration, and also how has that enhanced or rather added value to Athena as an independent tool, right? I mean, obviously, before you guys were using Athena, way before you guys bought in LeadSquared, so that was working as an independent tool itself. But has bringing LeadSquared and having that integration now also enhanced your leverage or your usage on the Athena side, right? How can we sort of have any kind of, if you can share any sort of measurable outcomes, whether it's on patient acquisition, whether it is increase in appointment bookings, whether it has been just more data clarity. Like, I know you've touched on, the ability to see data and have that accessible, but just independently, how has one tool sort of made you more in tune and sort of, codependent on the other? And how can we sort of, what are the top three measurable outcomes that you could say?
Yeah. So much, right? So before, again, we were working out of Outlook and out of a manual spreadsheet. Or with Athena, when referrals come in, they will come in, say, via fax or like an e-fax, but there's no way to communicate back to the referral source from there. And even in Outlook, everything was manual. But with LeadSquared, again, we've been able to build out logic and to create templates that will go automatically so that we can constantly keep our referral sources updated on the process of their particular patient that they refer to us. So before this, we were only making contact with patients. We were doing 3 attempts where we would try to reach out to them. And there also wasn't a good way to measure how long it was taking us to even make that first initial attempt or to accurately track, okay, I've made attempt 1, now I got to do attempt 2 for this patient, but I'm on attempt 3 for this one. But with LeadSquared, we're able to do that. So we've been able to increase our attempts from 3 to 5. And even just from that, the majority of our markets, we make contact with 100% of patients. We get their referral within 24 business hours. And in our Relieve Us market, for our legal patients, we make contact within 1 hour. But I'm able to do that again because of the LeadSquared system. And then for conversion, prior to this, when we were using spreadsheets, we were only converting about 70% of our referrals. Now I'm between 78 to 82% every single month. So just that alone, I mean, our ultimate goal, of course, is to get patients the care that they need. And now we're able to reach more patients and we're able to engage with our patients in a much better and more efficient way, as well as then keeping our referral sources constantly updated, with the communication for their patients. So they appreciate that because they no longer have to reach out to us and say, were you able to get in touch with this patient or what happened with this? Because now it's all automatic through the system. So it's really been a game changer for our relationships with our referral sources, as well as, again, getting more patients to be seen.
I know you touched upon a little bit earlier that we are now starting to also go one step forward and see, what was the success of these appointments that are being booked. And I know this is early stages that you're just starting to build that process out. But so far, have you seen any uptick or sort of any percentage in the show rates or sort of a decrease in no-shows because you were able to sort of automate and increase the frequency of the contact strategy?
Yeah, not specifically with that, again, because I'd have to run a couple different reports, so it's not as easily visible with that. But like I was saying, I have so many more plans with your team. Like, so one of the other things actually that I've talked to your team about is once we can build again and have the API set up to where I can see the outcome of that appointment, I would love to do another like campaign that again will be automatic. So it doesn't require anyone running reports and doing things, but for patients that didn't show up, to be able to like kick out a communication to that patient, reminding them, to go ahead and give us a call or the link to self-schedule so that we can re-engage them to get to that appointment. So I already have ideas as to how to kind of tackle that one. But
Awesome.
we're not there yet, but they're already in talks.
Perfect. Uh, Jeannine, has anything changed in terms of strategy, whether it was from the marketing side or whether it was from the contact center side or the patient engagement side, since you've implemented LeadSquared? Like, obviously, there has been, obvious changes in terms of leveraging the system,
Yeah.
but from a strategy standpoint for the business overall, like, has there been a significant shift or a change in that perspective?
Well, again, we were able to increase the outreach attempts from 3 attempts to 5. And then also with that 5 attempts, we do the multi-channel approach. So we're not just doing phone calls, we're also sending out the text messages to patients. Again, always tweaking too, like the verbiage in our text messages or even like the verbiage in our emails, like what is resonating more with our patients, to keep them engaged and to have them want to be a part of their care journey and give us a call. So that part we've done yet. But again, I think there's still so much more to come into what we're going to be able to do. So we should meet again like next year. And then I can tell you about all these other new things that we've implemented and our new strategies and what they are.
Awesome. Coming back to one of my earlier questions in terms of obviously since having LeadSquared, how has that improved um, things on the Athena side, right? Obviously, there is now flow of data. There is obviously so much more that's happening on the before the patients come into the door for their appointment. But have you seen sort of now more value also coming in from the Athena side or leveraging Athena as an EMR?
Um, well, for Athena, like with all of our intake, that's still done through Phreesia. So we don't do that with LeadSquared specifically. So with Athena, we're just booking, the appointments in there. Obviously for existing patients, a lot of that information is with the patient chart, which we have not tapped into LeadSquared for anything like that yet. So we're really just utilizing LeadSquared right now for new patients. We haven't yet explored what that would look like to integrate it more. Again, referral wise, we take the faxes and the e-stuff from Athena, referrals that come in, and we put them into LeadSquared to work them out of LeadSquared. Because Athena is really, again, just your medical history. It's not a tool to, work with customers, whether that be your patients or referral sources. Like it doesn't really have a good way to communicate back to referral sources. Plus, it can only fax out. Athena can't email. So that's where LeadSquared kind of comes in as that add-on tool to where we're able to utilize that to communicate back and forth with the referral source.
Perfect. Would you recommend this obviously joint solution to other healthcare practices, and why? If you could summarize that maybe in a few lines, and then followed by that, I'll take a quote from you that we can have as a one-liner on our website as well.
Okay. Yeah, no, I obviously definitely recommend any organization that's looking to utilize a CRM to look into LeadSquared, but to also look beyond just the technology piece. I mean, obviously, being able to integrate with Athena is critical. But again, for me, it really goes back to that partnership. And when you have a team like LeadSquared that is listening to you, is responsive, is able to adapt quickly, like that's top tier. So, and that has been my experience with LeadSquared. Oh, I lost you now. I can't hear you.
Oh, sorry.
Yeah.
If you could summarize the impact of Athena Health and LeadSquared working joint together in, hand in hand as one sort of seamless technology solution, what would it be? Like one summarized one-liner.
I would say, so before, again, LeadSquared, our referral management system was very manual, very fragmented. With LeadSquared, we're now able to have a seamless, patient-centered system that allows us to better serve not just our patients, but our providers, our referral sources, and our staff. Was that good?
Perfect. This was awesome. I think we've gotten some really, really valuable insights. Coming to one part specifically for our internal teams, and just any feedback that you have for us at LeadSquared, whether it was the implementation team, whether it is customer success, whether it is support, anything that you would like for us to sort of focus on a little bit more, improve on, whatever you want to share.
Yeah, I mean, really the only thing that comes to mind too was that reporting dashboard did take, longer than I would have liked to have gotten that up and running. But understanding that I did go back and forth a couple times with them to make sure that I got exactly what I needed. It almost looked like it was built more, again, for marketing as opposed to patient experience. And then the only other thing that we're still working through is besides referral management, our Relievus Market has another team that works. They're not referrals, but they're requests from like attorneys and whatnot that we're working through. And the system, it seems kind of silly, but LeadSquared wouldn't allow us to edit the to field. So, like for example, let's say an attorney sends an email and says, I need, such and such provider to write a narrative. When sometimes that may come to the coworker as opposed to going into the dedicated email, which would automatically go into LeadSquared. So then that coworker forwards it to the LeadSquared email to get it on LeadSquared. But when they go to work it in LeadSquared, when they hit reply, it would then reply back to them, not to who actually sent the original email. And we couldn't edit the to field.
Makes sense.
It wasn't like a total game changer because I could still put the attorney in the CC field of the email, but that was sloppy. And I wanted it to be right. And so again, we worked with your team and they're still working on that. They said they can do it. And I want to say, I don't remember the time frame they gave, but like maybe 2 or 3 weeks. So I did have to delay that part of implementation. But again, this was different. This wasn't like the referrals that we're doing. There's a little bit of a different task or work item so that we're just working through with you guys. But like I said before, anytime I come to your team with anything, they will come back and try to work with me to fix it, so I appreciate that.
Perfect. This has been super awesome. And I think this is very valuable. I think a learning, and as part of this exercise that I'm starting to do now, while obviously this helps me from a partnership standpoint now that I'm sort of doing multiple roles, but I think now I'm focusing more on building the partnership with Athena. I think it is also very helpful as I'm doing these conversations and I'm learning a little bit more about different use cases as well, and sort of different areas where we can improve. I think a lot of times what happens is we have one, maybe two people interacting with customers on a day-to-day basis or on a weekly basis. And not a lot of times those conversations are rooted in terms of, core feedback or learnings and things like that. So I think this becomes a great sort of exercise for me and for the rest of the team. So I really appreciate